You are looking for hair transplant for your hair loss. You may be grade 1 till 7, but you don't know in which grade you fall. So you've come for consultation to your doctor, and now you want to find out what can be the best possible treatment for your kind of hair loss. So in order to educate you for what treatments you have, what long-term treatment you require, what all things you need to consider, medical therapies, medical treatments, oral pills, topical ointments, solutions, and hair transplant surgery. Along with that, sometimes SMP or scalp micropigmentation. So what all things of the basket you require when you want to get your treatment done, we wanted to make a video to educate you to find out what can be best for you. So welcome to the series of videos. We'll be making 3 videos, and in 3 of them you will be able to understand in which category you fall and what will be the best possible treatment for you. So mind you, there cannot be any one treatment, and nobody can tell that this is the best possible thing for you for sure. So there can be so many variables, like what is your age, what kind of hair loss you have, then what is the donor area, how is the recipient area, and so many other factors. So in order to discuss this, let us find out today the best possible treatment options for grade 1, 2 and 3 Norwood Hamilton. Hi, my name is Dr. Preeti Saraswat. I'm an American board certified hair transplant surgeon, and today we'll be discussing the first video in the series, Educate Yourself for Your Hair Problem. Please subscribe to this channel for more such educative videos. Let us discuss what is Norwood Hamilton grade 1 and 2. So if you draw a line between both the tragus, as you can see in the depiction on the screen, if you draw a line by joining both the tragus, which is the part of the ear, then 2 centimeters ahead of it is the line, imaginary line, in front of which if you are having hair loss, then it is Norwood Hamilton grade 2. And if you are having a minimal kind of hair loss in which you feel there is some receding and some thinning, then it is Norwood Hamilton grade 1. So if it is grade 1, usually we do not tell you to undergo any surgery. The main treatment for grade 1 is medical treatment. So according to the US FDA, the main medical treatment for men in Norwood Hamilton grade 1 or any of the grades, the medical treatment is oral finasteride tablets 1 milligram and topical minoxidil. So this, along with the various multivitamins you can take which are specifically for your hair, so that they get benefit of nutrition and those macro and micronutrients which are required for the germ cells to grow better hair. So these multivitamins along with minoxidil and finasteride comprise the major part of medical therapy. Along with that, you can consider option for PRP therapy or mesotherapy, along with derma rollers and along with the low level laser therapy. So here at Saraswat Hospital, we always give you a triple therapy, which includes not only the laser cap, which works on the principle of photobiomodulation. Along with that, we do a derma roller also in a very particular way, and then the PRP or mesotherapy as is required by you. So in order to benefit you by this thought process of telling you the treatments grade-wise, according to the grade of your baldness, we prepared this scenario. If you're liking this thought, then please click on the like button. Coming to the Norwood Hamilton grade 2 baldness. Again, coming to the reference line, joining the 2 tragus points. If you join the 2 tragus points and you draw a line 2 centimeters ahead of it, an imaginary line, and there is baldness still there, your frontal hairline has receded till there, then it means you are suffering from grade 2 Norwood Hamilton baldness. In such cases, as we know that most of the hair on the head is already there, so number 1 preference is given for medical treatment in order to let those hairs stay for a longer period of time. And if still you are worried for your receding hairline or temples, then maybe for construction of better hairline, which is called strengthening of hairline, we may be providing you with a certain smaller number of grafts in order to give you a better hairline, a better framework for face, and to boost up your confidence. This number may range anywhere between 800 to 1200 to 1500 depending upon the shape and size of your face. Of course, the availability is there, and also depending upon the type of hairline you want want or you wish for. If you want to know more about this, you can ask your question in the comment section below, or you can call us on the numbers below. We can have a consultation with you. Let us now discuss Norwood grade 3. So if the same line, the arbitrary line of 2 centimeters ahead of the tragus, if the temporal recession goes deeper than that, such that you find deep triangles on both the sides and also maybe in the front also there is receding hairline, then it is grade 3. It may or may not be associated with type A, which means the hair in the front is also gone, or type V, which means vertex also is involved along with that. So it means your hair loss is progressing more and you definitely need medical treatment along with surgical treatment if you want a better framing of face. So in medical treatment, again, you need to take the US FDA approved finasteride. If you want to know more about side effects of finasteride, of which internet is booming about, you can click on the video link above. And you also need to take minoxidil along with various other therapies like PRP, mesotherapy, dermaroller, or low-level laser therapy. So if you want to know more about how dermaroller is beneficial with minoxidil, you can again click on the link above so that you understand all these things better than your understanding at present. So talking about medical therapy, it is essential for your hair which you have at this point of time. In order to have better framework for face and for the receding triangles, you need to undergo surgical hair transplantation and after trichoscopy, which will tell us the quality of grafts at the back, how many grafts you have and how many we need to implant here. Taking the area of recipient side, we can do the transplant and you can have a better framework. So in these cases, usually the number of graft requirements ranges from somewhere 1800 to 2200 or maybe 2500, depending again on the shape of your face, on the size and shape of your hairline. So your family, your friends or other people or your acquaintances who may be suffering from hair loss up to grade 3, you can share this video with them so that they also get educated regarding the choices they have for their treatment. Now I would like to discuss in a very few words the temple points or temporal points which many of you want to have if you are having thinness here or it is parallel or it is receding. So in those cases where we have very good donor side and we feel that yes, it will frame the face better and it will decrease the length of the forehead so that you look smarter, the doctor may agree that yes, you should go for the temporal point. But in cases where it is presumed that the hair loss will be so rampant that the hair at the back of the temporal points will go on getting thinner, your doctor himself or herself will ask you not to go for them because you'll be better off without them and you can have a better number of grafts on the top and front rather than the temporal points. So do have a good discussion with your consultant before you opt for temporal points. If you want to know about side effects of tablet finasteride, click the video on the left. And if you want to hear the testimonial of a patient who was grade 3 bald but reaching grade 4, please click the link on the right.